how to write a properly formatted KQT Health HPI statement, part of the KQT Health documentation program. The 5W HPI was developed by KQT Health and must be used by all staff completing non-emergency ambulance transports. An accurately written 5W HPI statement provides the information generally required by the Center for Medicare and Medicaid Services, as well as most other insurance carriers, to show the need for non-emergency ambulance transport. When writing your 5W HPI statement, you must number your responses using 1 through 5 format. This standardized format provides consistency in your documentation and allows readers to quickly locate pertinent information when needed. Write the question number followed by the response for each of the 5 questions. When writing your responses to the 5W HPI questions, you must write your answers using complete and grammatically correct sentences. A grammatically correct sentence is one that contains a subject and an action, expresses a single complete thought, and uses correct capitalization and punctuation. Remember, your writing skills reflect on who you are and demonstrate your education and professionalism. HPI Question 1. Where is the client-patient currently located? Every non-emergency medical transport starts from some specific location. In answering this question, you want to identify that specific referring or pickup location by name. Also, be sure to include other identifying information, such as room numbers and/or unit names, when applicable. If your client is currently admitted to an acute care hospital as an inpatient, include the date of admission in your response to question 1. Example: the client was admitted to room 412 on a medical floor in Stargazer Medical Center on January 15, 2019. HPI Question 2. Why is the client patient at this location? Regardless of the location type other than a private residence, the client is at the referring pickup location for some specific purpose. The purpose will vary based on the type of referring pickup location. We will first look at a hospital example. The client was admitted with a diagnosis of COPD exacerbation and received treatment for respiratory difficulty. The client received an examination including radiographic studies and was treated with medications. Even when the referring pickup location is not an acute care hospital, you want to identify the condition and care that was provided at this location. Skilled nursing facility example. The client is a resident of the skilled nursing facility and receives 24-hour-a-day skilled nursing care. Dialysis treatment example. The client completed scheduled hemodialysis treatment for end-stage renal failure. This same structure, identifying the condition and care that was provided, must be used for any kind of medical treatment and/or diagnostic testing appointment. When the client is being picked up from their private residence where they live, there is no need to identify a condition and care. In these cases, the response to HPI Question 2 can simply be private home residence. No further explanation is required. HPI Question 3. Where is the client patient being transferred to? Just as with HPI Question 1, every client being transported is going to some known location. So in answering Question 3, you want to specifically identify the receiving or drop-off location by name. Again, also be sure to include other identifying location information such as room numbers and unit names when applicable. In the case of a client being transported to their private residence, there is no facility name, and you can therefore just write the client is being transported back to their private residence home. HPI Question 4. What care, treatment, or service will the client patient receive at this new location? Every person transported as a non-emergency medical transport is being taken to a new location to receive some specific care that has been identified and ordered by their physician or healthcare team. This could be for a specific test, procedure, or generally more comprehensive care that is not available at the client's current location. You must record in your HPI response to Question 4 what care or services will be provided for the client at this new location. If this information is not clearly listed in the transfer documents or dispatch information, you must ask the current caregiver why the client is being transferred. Example, the client will receive continuous medical monitoring and treatment for chronic COPD, including oxygen therapy and Alzheimer's care. Similarly to HPI Question 2, your response to Question 4 can vary based on the location. Some other examples are physician appointment. The client will be seen by her orthopedic surgeon as part of postoperative care following hip fracture. Private home or residence. The client is returning to private home residence and will have family or self-care. Daycare programs such as Mercy Life or Lawrence House. The client will receive supportive care as part of a medical daycare program. Finally, HPI Question 5. Why does this client patient require transport by ambulance? Question 5 is asking you about medical necessity for the non-emergency ambulance transportation. Medical necessity is based on the client patient's physical or cognitive condition at the time of transport. You want to list any and all conditions that require the use of ambulance in completing the transport. You are not trying to justify the ambulance use. You are reporting the facts of the transport. The billing staff will determine medical necessity based on what you write in the HPI and elsewhere in the patient care report. Your response to Question 5 must include specific documented diagnosis. Generic statements such as weakness or inability to ambulate are not sufficient on their own. Example response: the client must be transported by ambulance for continuous oxygen therapy due to COPD and is unable to self-regulate due to Alzheimer's disease. The client is an elopement risk due to confusion from Alzheimer's disease. The conditions listed in the HPI question response, COPD and Alzheimer's disease, need to be included in the past medical history section of the patient care report. For more information about medical necessity for non-emergency ambulance transport, please watch the Quick Take training lesson Understanding medical necessity. If you have any questions about the material or information presented in this quick take training lesson, please contact the clinical operations team.